So Mr. Case, this is Dr. Lenahan. It's April 30th, 2014. Now we're doing the arthroscopy of your right shoulder. We're looking from the back of your shoulder toward the front. You're lying on your side with your left side down toward the table and your right side up toward the ceiling. And since we're looking from the back, then your head would be over to our left and your feet down to our right. We have a little probe in the front, which we'll use like a little finger to point things out and show things. Gives you an idea of size too. The probe, from the tip of the probe down to the shank, is a little less than 1/4 of an inch long. It looks a lot bigger because things are magnified here on the TV screen. So up above us is the humeral head, the top of your arm bone. This is the socket side of the joint called the glenoid. This long white rope-looking structure right in front of us is the long tendon to your biceps muscle here. It attaches to a cartilage bumper inside the shoulder called the glenoid labrum, which should be really firmly attached to the bone in here, but it's not. It's actually pulled completely away from the bone, where we can look way down past the edge of the glenoid in here with that. So the labrum's been torn off up around the top here. If we come on the other side, this is the undersurface of our rotator cuff here, and we've got some fraying in the tendon up on the top here. It actually, I think, comes into a frank tear in the tendon right here, where there's a hole right through the tendon in this area, and this is supraspinatus starts here, so the back edge of our supraspinatus into our infraspinatus tendon here. And then we'll pull back and look at this a little bit more. And so we have this cuff tear in this area, and it stops about right here. This is a bare spot in the shoulder. And then we come into the very bottom of the shoulder down here, and we'll come around. Humeral head here had some damage to it, kind of beat up a little bit right here because of the instability in the shoulder and some articular cartilage damage there. The labrum on the bottom of your shoulders had some damage down here as well. See if we can get our probe all the way down here. The labrum may be torn off completely in the back. We'll come to the front and look at that some more, but I'm concerned about that. We'll look at the labrum in the front here, just distract and then externally rotate a little bit. So our labrum in the front down low is intact, which is good. That's an important section, this anterior glenohumeral ligament, and that's intact, which is great. And so we have a fair amount of damage here within your shoulder. We also, if we look in the front, where the biceps is, this area is called the subscapularis tendon, and that's been torn loose from the humerus here in the front. We have a little metal needle in here sort of showing where the front edge of that is. So you have very, very extensive damage to your shoulder, rotator cuff tears in the back, up in the front, some fraying on top, and then labral damage within the shoulder, which is really significant as well, up on top and possibly in the back. So what we're going to do is start to clean things up here a little bit so we can see better in here. You're going to bring a little motorized shaver into your shoulder. This has a sharp metal blade on it. Turn my outflow off. And it's going to oscillate back and forth, and we can attach this to a little suction. So we're going to take and start to trim down a little bit of the leading edge of the labrum, which has been frayed and damaged and is not doing you any good there. We'll get it back to sort of more stable, healthier tissue here. Good. And what we're going to do is I'm going to put another little cannula. We have little plastic cannulas we can put in here. I'm going to put one in the back here, and we'll look from the front toward the back and see what sort of damage we have in the back here as well. Chris, what I've done is I've changed my view where I moved the camera into the front looking toward the back. This is the detachment of our labrum up on top, where it's completely pulled away from the glenoid here up on top. It's become a little lower in the back. I think it's attached. It's had some damage to it, but it's still attached to the edge there. I can't pull that back away from the edge, even though I'm pulling on it pretty hard here. I'll change my view here just a little bit. Help us with that. This is down low in the back. No, you can just relax on that. Where that's still attached to the labrum, it's just had some damage where it's been running over the back here and has damaged that. So we're tighten this tissue down here, and it's just caused some damage. You can see it's got some unstable cartilage right here. And so we're just going to bring a little shaver in and clean off that little bit of cartilage in that area. But I don't think the labrum down low in the back needs to have work done to it. It's had some damage, but it's relatively stable. What I want to do is to get these loose pieces of cartilage out of here, because those loose pieces can go on to have additional damage, and they make a little area that can get grabbed on and can make it easier for that articular cartilage damage to progress. So we're just going to trim that back a little bit, and that's already cartilage that was non-functional anyway in that area. So, all right, so that's down low in the back where I think the labrum is damaged but not detached, or most of our detachment is up on top. So I'm going to swing around and we'll fix that labral detachment first, and then we'll set about fixing your rotator cuff. So Chris, what we've done now is that superior part of the labrum that was torn loose, we put a little anchor into the edge of the glenoid here, loop it around the labrum and tighten that down. So we pull it right up against the bone, which we roughened up underneath it. And that should hold it up against there for several months. That's a permanent suture. And so that should do well with stabilizing that superior part of the labrum, the upper part toward the back. Now we're going to go ahead and put a second anchor in the front here to do the same thing right there in the front. So Chris, here our second anchor in the front, holding the labrum down in front of the bicep. That looks really good. So that part looks great, the labrum inside. Now what we're going to do is we're going to swing outside and look at fixing the rotator cuff tears. The first one's up in here. Spinal needle, another one please. We're going to kind of mark that. We have a cannula that's sort of where we would have wanted to be typically. Hang on to that. And what we're going to do is we'll take that cannula out, that upper one here, and we're going to mark where that rotator cuff tear is on the top. Spinal needle, please. Right about here. All right, so that needle's kind of marking that, so we'll look at that from the top. That's our upper posterior part of the rotator cuff tear, and then of course we have this anterior part up in the front here as well. Chris, here's the rotator cuff tear from above. Probe, please. Where the tendon was torn loose here. The one in the front we're not seeing well with the scope, so we're probably going to have to open that one to fix that one, Chris. But here's the one up on top where the rotator cuff is torn through. We've roughened up the bone. We put a little anchor into the side here, and if we tighten this down, it's going to pull the cuff over, down onto this bone there, really very firmly. See that? It's beautiful. Going to hold that there really nicely. We have a little permanent anchor in there, and these sutures are permanent as well, and so that will hold that in there long term. It should work really effectively for this. So that looks really good.